how we can narrowing exit path in our throat section, vocal cords placed inside the pipe, right? In first section, if except surgery and medical drugs, I mean where people need a medical treatment, there are only three techniques to have a strong and deeper voice. In other methods, we just change the tools, and in fact, all of them are one of these three. Today, we will talk about these techniques to have a strong sound and use it such as a sword to conquest success in our daily negotiation. As I said, today we learn three techniques to produce a powerful sound that it could be useful in your communication skills and even as a routine exercise for singers as well as voice therapy. The first technique, we should get larynx ready for next steps, next level. And in the first technique, we're going to warm up our larynx. Okay, so the first technique is massage for our larynx. But about how we should do it, um, you should push your fingers inside the side of your larynx and down. Exactly same this job. You can do it in different ways. As example, you can do it like this. Just push and down, up to down. Okay. Here. After about 5 to 10 times, 5 to 10 times massage from up to down, you should push your fingers from side to inside, exactly like me. Push your larynx. You can do it in different ways. So 5 or 3 times up to down, 5 or 3 times push from side. In medical therapies do it this job for you with a special vibration, and so we can do it with a special vibration for massage. That I have a gun vibration here, so we can do it. We can do massage, larynx massage with vibration, up to down, push to down. Okay. As I said, in medical, they do this job for you with a special vibration. There are different methods, there are different ways to massage your larynx. The only thing that is important is you should do larynx massage. And ways, it's not matter, okay? Imagine this pipe is my throat, or vocal cords placed in this pipe, exactly same photo. And here we have a larynx. This is larynx. Larynx is our sound resonance box. that airflow shaking vocal cords here and make raw sound. I said raw sound because the sound should have been processed by the mouth, tongue, and teeth, and then we have the final sound. And our lungs here produce airflow. The second technique is about practice vocal cords and how to produce a strong airflow with the most pressure. When you breathe normally, you don't use your lungs to their full capacity. In fact, you don't use your airflow capacity completely. The second technique is diaphragmatic breathing, which allows you to use your lungs at 100% capacity, increase lung efficiency. To do this job, to have a diaphragmatic breathing, imagine you want to inflate your abdomen. I mean, filling the abdomen with air. You shouldn't breathe by your chest. This is wrong. This is wrong, okay? This is chest breathing. You should do abdomen breathing, diaphragmatic breathing. Okay? If it's hard to you to have a abdomen, to have a diaphragmatic breathing, you can lean to the wall. You can lean to the wall, okay? And try again. Do it for about 3 or 5 minutes. As I said, our throat is like exactly same this pipe that vocal cords placed into this pipe like this, and in larynx section, vocal cords placed inside the pipe, right? In first step, we learn how to warm up the larynx and vocal cords, and how to larynx get ready for next steps. Here we have a larynx. In second step, we learn how to produce airflow with the most pressure. But about the third step, as you know, we produce airflow here in our lungs, and airflow comes from down to up, right? And shaking these cords. In third step, we want to collect airflow. We want to collect air here behind the cords to produce the most pressure and shaking the cord with the most pressure. But about how we can do it. So, as I said in this job, flow collect behind the cords and then push and shaking cords with the more pressure. We can do it in this pipe by narrowing the exit path. But how about our throat? How we can narrowing exit path in our throat? To do this job with your throat and narrowing the exit path, you just need a straw and breathing and blow air into this straw, like me. And you can do it with other same tools. This technique is named the sovt in the medical, and the tool is ovu straw. Of course, I don't suggest you to buy that. You don't need. As I said, you can do it with uh, drinking, with drink straw, with pen pipe, with other type of pipe. Um, you just need a simple straw. You don't need a steel straw, right? And now we need a mix of massage, diaphragm breathing, and making sound through the straw. You can do it with. You can do this technique with massage or without. As a final point, you should massage your vocal cords again after all techniques, after each technique, after each practice, or just do it as a final point. Massage gives your vocal cords flexibility and in the final step gets them out of tension. During the exercise, drink water, not warm and not cold. Now let's have a review. The first one is larynx massage. Second was diaphragm breathing. And third one is yelling in straw. You need only three or 4 minutes to do each step and need 2 months to give you a strong voice. You can do it before business meeting or if you are singer before singing to warm up your vocal cords, or if you are a professional person in solfege, mix this practice with your professional exercise to get a lower pitch. And to eliminate hoarseness, you need a special diet, which we don't talk about it in this video. I'm looking for a practical topic which help us to have a better life, healthy, and more money, and so. Uh, then you can also help me to find topic. Just leave your suggestion in comment section. Okay, see you soon.